Hi, my name is Tara George, and I am Chief Resident of the Internal Medicine Residency Program at Magnolia Regional Health Center.
My name is Mary Avery Poole, and I'm one of the internal medicine attending physicians at Magnolia Regional Health Center.
Hi, my name is Lindsay Bedford, and I'm an intern in the Internal Medicine Residency Program.
Hey, I'm Cody Maddox, one of the PGY1s at Magnolia Regional Health Center.
The first time I experienced the Magnolia Residency Program was during my interview process, which was virtual due to COVID. Even though I did not get to see the hospital, meet the residents, or faculty in person, I could tell it was an excellent program.
The core faculty here at MRHC are truly vested not just in patient outcomes and education, but also the overall well-being of residents, their training, and the program as a whole. The level of supervised autonomy at Magnolia forces you from day one to step into the true role as a doctor, making those difficult decisions. From the complexity of patients we care for on a daily basis and the procedures that we routinely perform at bedside, to the daily learning didactics, which includes Mix-Out and Harrison's. All this challenges me to be a better doctor, and I feel this is something Magnolia does exceptionally well.
Magnolia prepared me as an attending physician by the rigorous coursework, guidance by the faculty, and the autonomy that has allowed me to have the confidence and skills to practice on my own.
From a training standpoint, practicing in a rural setting is unlike anything I've ever done. Our patient population consists of the most underserved, underprivileged, and uninsured in the nation, yet they are the most grateful for our care. We see a wide variety of disease pathologies and learn how to manage them because subspecialty consultants aren't always readily available to us.
As someone who grew up in the Midwest for most of my life, I did not know what to expect when moving to Mississippi. The day I moved in, all of my neighbors came over sometime throughout the day to introduce themselves. They all said something similar to the effect of, "If you need anything, feel free to call me."
I'm originally from New York, and when I started here, I was a little nervous because I had spent most of my life in the Northeast. But within the first 24 hours of moving here, I realized how welcoming Corinth was when our neighbors, who were complete strangers at the time, helped my husband and I move in.
I signed on as faculty and as an attending at MRHC after graduation because I love this program. This program is very close-knit, and your co-residents will become your family. They will support you in your decisions and always be there for you.
Corinth is a beautiful small town, and I love being able to explore some of the cute boutiques and shops that are downtown. Go to the local coffee shop. There are also many great places around town to go on walks or hikes, which is especially nice after a busy day at work.
Training at a rural hospital means that our residents are the first to respond to any critical scenario in the hospital. We are the airway team, code team, and procedure team daily. I personally have a strong interest in critical care and plan to continue my training in a fellowship in pulmonary and critical care. And I feel that the training I received here has prepared me well for any field that I want to pursue in the future.
Coming from a small town, Corinth, Mississippi is just the right size in my opinion. Southern hospitality is a true thing, and Corinth has no shortage of it, especially when it comes to the new residents in town. There are plenty of options throughout town to dine and shop. Downtown Corinth is a perfect spot to hang out with a group of friends. If you enjoy water sports, Pickwick Lake is just 30 minutes to the north. There are countless state parks in the area for biking and hiking. With large cities shopping such as Memphis being 1.5 hours to the west and Nashville about 3 hours to the north, and just over 6 hours to the Gulf of Mexico for quick beach trips.
I've really enjoyed my residency, which is not something you hear often because residency can oftentimes be the most difficult part of a career in medicine. I'm grateful for the opportunities I've been given at Magnolia and for the confidence I have I can pursue any medicine subspecialty with the training I've received here. My goal as chief resident is to ensure that every single resident that goes through our program feels exactly the same way.
For me, the advantages of going through residency at Magnolia Regional Health Center is I truly feel I'm learning to be a confident provider in both the inpatient and outpatient settings. And with limited consulting and referral services, they force you to become knowledgeable in all aspects of patient disease and care, to take into account the whole patient picture, including socioeconomic status, local resources, the type of insurance they have, and so much more. But most importantly, this is the patient population I will be caring for throughout the rest of my career, and I am blessed to be able to learn from a wonderful group of physicians who exemplify the type of care I wish to emulate moving forward.
So far, my favorite part of the program is the camaraderie amongst the residents and attendings. Both your upper levels and attendings really want to see you succeed, love to teach, and are readily available to answer any questions you may have. The days are busy, but going through the day with people who feel like family makes the day go by quickly and the work more manageable.
I had great mentors and experiences at Magnolia, and I wanted to give back to the next generation of physicians. My advice to incoming resident physicians is to always ask questions and always advocate for your patients. As with any program, there will be highs and lows during residency, but you must take each experience as a learning opportunity. Here at MRHC, your co-residents and faculty will help you get through anything.
Future physicians, I'm Peyton Priest, the Program Director of Internal Medicine here at Magnolia Regional Health Center. At Magnolia, we challenge and encourage our residents to become the future healthcare leaders of tomorrow by achieving excellence in academics, clinical, and leadership skills. With an emphasis on high-quality patient-centered care, we focus on quality and safety metrics to prepare our residents for a smooth transition to attending life and the expectations that follow. Because we are a community training program, our residents get hands-on experience with many different procedures. The internal medicine service performs the vast majority of bedside procedures for our inpatient population. Due to the procedure skills learned at our institute, this allows our graduates to be better prepared for independent practice and fellowships than most current internal medicine graduates. The culture and expectation of our residents is one of collaboration and commitment to ensure you achieve the autonomy and growth you deserve as you advance through your career. We look for residents who prioritize self-improvement while also being an advocate and resource for fellow trainees. We are a strong, close-knit family within our department, and our GME leadership will always provide the support you deserve throughout your training. We hope that you highly consider Magnolia as your choice of training and encourage you to reach out if you have any questions or would like more information. Best of luck with your career and future endeavors.